Medical services for survivors of sexual violence.
Hi, my name's Karen Giles. I'm one of the sexual assault domestic violence nurse examiners here in Peterborough. I have special training to support victims of sexual or domestic violence. We have a team of specially trained nurses who are on call 24 hours a day, 7 days a week. That means we have time to spend with you, we're not rushed, and your needs are our priority. We're able to provide your medical care, and if we need access to the emergency doctor or a nurse practitioner, we can do that during your visit. Our service is located at Peterborough Regional Health Centre, and we provide this support to victims of the 4 counties of Peterborough, City of Kawartha Lakes, Haliburton, and Northumberland. You can call the program in advance of your arrival at 705-743-2121 extension 0 and ask for the sexual assault domestic violence nurse on call. First, you will need to go to the emergency department of the Peterborough Regional Health Centre. When you arrive at the emergency room, ask to see the sexual assault domestic violence nurse. You don't have to tell your whole story, but the triage nurse will ask what medications you're on and take your temperature and blood pressure. You'll be offered a private space, and they will contact the nurse examiner on call, who will come to see you within a short period of time. We support victims of all genders and sexual orientations. When you come to see us, we provide all the possible options for health care and allow you to choose which options are best for you. This visit is confidential and no one is notified unless there are children at risk of harm. We do not report to the police unless you ask us to. Your options include emergency medical care, crisis counseling support, emergency contraception, STI testing or treatment, forensic evidence collection and documentation, which may also include photo documentation. Our program also includes ongoing counseling by specially trained social workers. Everything is free, everything is confidential, everything is your choice. Timing is very important. If you suspect you were sexually assaulted, come to the hospital as soon as possible. It is best if you have not showered and have your clothing from the time you were harmed, but it is okay if you have showered. We can support you in both cases. Some medications are only available in the first 72 hours after the assault. If you're unable to visit us in the first 72 hours, we are still able to collect some forensic evidence up to 12 days post-assault. Even if you decide not to collect evidence, there is medical treatment available to you. Sometimes we find victims question whether it was their fault, what they could have done to prevent this, or if this was really a sexual assault. It's never your fault. If you're not sure, come and talk to us. We're here to help. We're not here to judge. We also offer a special program for children who have experienced sexual abuse. Please see the link on this website for more details.